Hi, you guys. Welcome back for our daily practice questions. It is day 78, and as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, Q banks, digital flashcards, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know that there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Also, if you're looking to grab the last spot for this upcoming 5 week review, make sure you click the link to enroll. All right, question number one. Which of the following cranial nerves is primarily responsible for facial sensation, including touch, pain, and temperature, as well as motor function for chewing? Is it A, cranial nerve 2, B, cranial nerve 5, C, cranial nerve 7, or D, cranial nerve 9? Take a moment and tell me what you got in the comments, y'all. All right, so I always recommend reading the stem of the question first, but in this scenario, the stem is the question and the question is the stem. So it states, which of the following cranial nerves is primarily responsible for facial sensation, including touch, pain, and temperature, as well as the motor function of chewing, right? So remember, cranial nerve 5 is the one that is more along with the chewing and the cheek and the sensation in that region. So B is your best answer, cranial nerve 5, whereas cranial nerve 7 is more of overall facial. Just give me a moment, we'll get into it. All right, question number two. During a neurological exam, a patient is asked to smile, raise their eyebrows, and puff out their cheeks. Which cranial nerve is being tested by these actions? Is it A, cranial nerve 2, B, cranial nerve 5, C, cranial nerve 7, or D, cranial nerve 12? Take a moment and tell me what you got, y'all. All right, so same thing here. The stem is the question is the stem. So it states during a neurological exam, a patient is asked to smile, raise their eyebrows, and puff out their cheeks. Which cranial nerve is being tested by these actions? So here, the best answer is C. This is cranial nerve 7, where the full um, facial nerves are utilized. So to smile, raise their eyebrows, and puff out their cheeks. Whereas cranial nerve 5 is more to that jaw, the chewing, and cheek region. That's why if you think of trigeminal neuralgia, they have like that sensation in the cheek, pain in the cheek, and that's associated with cranial nerve 5, right? So when you look back at question one and two, I want you to pay attention to those things so you don't miss these types of questions on boards. And then lastly, question number three, which cranial nerve is responsible for the majority of eye movements, including up, down, and inward movements? Is it cranial nerve 2? Is it B, cranial nerve 3? Is it C, cranial nerve 4? Or is it D, cranial nerve 6? Take a moment and tell me what you got. All right, so which cranial nerve is responsible for the majority of your eye movements, including the up, down, and inward movements? All right, you guys, this is B, cranial nerve 3. Cranial nerve 3 is your ocular motor. So it controls the functioning, is what I'm trying to say, for lack of better words, the mobility, the movement, the functioning of the eye to move up, down, inward. Also, like your pupil constriction and all of those things. That is cranial nerve 3. B is your best answer. Make sure you know all of the eyes and be able to identify one versus the other. All right, you guys, we'll continue to do more cranial nerves and I will give you scenarios so that you can kind of see them in different aspects. I hope you found this helpful, and that the explanation kind of helps you tie it together. But as I always tell you, repetition is the key to retention. So make sure you keep these cranial nerves in front of you. But as always, please be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. Everything that I do offer is linked in the bio of this channel, including my website. But as always, if you're looking to book any of my one-on-one sessions or any of my custom packages or plans, I always say either call, text, or email, as I prefer to speak with you first so that I can gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.